All right, hey everybody, how y'all doing? This is Derek with the new grad mini series. I have with me Brooke and Erica. We also have a very special speaker with us today, and that's Dr. Gibbs. What our goal for today is going to be, we've talked about in several of the series about interviewing. We talked about clinical practice. We talked about what you should be looking for. So now we wanted to turn the corner to try to get other perception of those different things from an actual doctor and how he views us as our registered dental hygienist and what he looks for or what other doctors in the practice may look for during that period of time. I want to turn it over to Brooke. She has a couple of things she wants to talk to you all about, and we'll go from there.
Yeah, and just to remind you guys, this little mini series that we have going on, so far we've done board prep, we've done questions about interview, we've done clinical preparation. So if you guys like these videos, make sure to subscribe to Brown Girl RDH on YouTube. Also, make sure to follow on Instagram, follow on Facebook, and become a member, guys. I cannot stress this enough. It's super cheap for a student. It's $20 a membership. You get scholarships to loops, to conventions. I think there's also scholarships to help pay for boards. Once you guys have graduated, you can upgrade your membership to professional membership for only $30. So also they do a lot of stuff such as mentoring, employment resources, and yeah, it's a great opportunity, guys. Don't miss out on it.
All right, as we go into it, Dr. Gibbs, would you like to say a little bit about yourself before we get started so the viewers have an idea of where you're coming from and your perception?
Yeah, of course. So my name is Dr. Gibbs. I am a general dentist. I work in a public health setting, so in a community health center. I have my master's in public health as well. So community health has been, in my blood and has been my passion to help those in need and to serve a population that lacks dental care. I enjoy making music. That's one of my, I don't know if you can see a little keyboard in the background, but I choose to have fun with dentistry, and I love education and I love entertainment. And so therefore I try to kind of deliver dental information to my viewers, but in a fun, unique way. And so I take, songs and I change the lyrics and I deliver useful information for brushing, flossing, and the importance of it in different diseases that can relate from the mouth to the rest of the body. So just having fun with the field, giving back as much as I can, participating in interviews such as this, and just to kind of promote the field and show how great it is, and just encourage everybody to just keep pushing and keep going. This is an amazing field.
Hey, Dr. Gibbs, what kind of music do you do?
I do everything. I mean,
let's see, spit us a little something.
Okay.
I'm going to give you a beat. Here we go. No pressure. Right.
I can do it a cappella. It's okay. I say some of the first signs of diseases show up in the mouth like cancer, HIV, and diabetes. If not detected, they become untreated. Believe it or not, a single tooth can get infected and cause you to become septic, having you seize like you was epileptic. So the next time you want to talk about how dental insurance is weak and the coverage needs a slight little tweak, I want you to know that dentists are doctors. And if you implement that concept, then so will our United States Congress.
That's one of them.
That's awesome.
That song I wrote just to kind of like, everybody complains about how dental insurance just sucks and it's just horrible.
Yeah.
And I don't want to blame the insurance companies for that. I want to kind of blame us, because not us as in like the dental profession, but the general public, because they don't see the importance of their oral health. Mm-hmm. Therefore, when bills come up and people are fighting for bills to kind of include things in insurances, nobody's voting for these bills. They're not giving any support. And so Congress doesn't see the importance of oral health. Therefore, there's no pressure on these insurance companies to boost up our benefits and make dental insurance better. So mm-hmm. it's not the insurance people's fault. I guess you can say the company's fault. It's our fault for not mm-hmm. supporting that.
Back on the people.
Yep.
Voices heard, and we're passing that information on about the importance of oral care and the systemic link that it does have.
Yeah, definitely. There's a lot of other songs where I deliver different types of messages, and you can check that out at on Instagram. It's at Dr_GIBBZ, and then on Facebook it's just Gibbs DMD.
All right, cool.
Okay, definitely. We'll repeat that at the end to make sure if anybody misses it. But as we go into it, ladies and gentlemen, let's go ahead and get into our question and answer session. We already see Dr. Gibbs is very intuitive. He has the information that we want to get out to the community. So the first thing I wanted to really talk about, Dr. Gibbs, is the interviewing process. When you have a hygienist opening, what are some identifiers that you're really keying on for those prospects when it comes to the resumes and the cover letters before your actual face-to-face? What are those identifiers in that resume or cover letter that gives you the better idea that this person may be someone you would want in your office?
So the things that I look at are, so I'm gonna kind of make it simple. The things that I look at are things that you are not obligated to do as a hygienist, as an employee being part of a clinic as a hygienist. So when I look at a resume, I look at all the extracurricular activities that are listed on there. If there's volunteers, if there's events, if they created a nonprofit, if they're a part of a nonprofit or organization and they elaborate, they talk about stuff that they did there. I look at all those things because being a hygienist, you're doing the duties of a hygienist. If that's all you have to offer, okay, every other hygienist has the same thing. I want to see what's going to set you apart from everybody else. What are some of the extracurricular activity things that you're doing that you may not be getting compensated for? And maybe that it doesn't even have to do with hygiene at all. It just kind of gives me an overall picture of who you are. That way, when I sit down face to face with you and I interview you, I want to see if what the words I read on this resume or this personal statement or whatnot reflects the person who was sitting in front of me now. So I just want something that's different. I want somebody who's well-rounded in the sense that, you know, hey, they'd be willing to go do some outreach events. And it's not only like, okay, I just got to come to work and I just got to do these hours and then I'm out. Like, I want them to have fun. I want them to enjoy their time. And those extracurricular activities kind of give me an insight as to their personality somewhat, and then their motivations and their passions. So I look for those extracurricular activities in resumes, and it gives me a better picture of them.
Can you give us a couple of examples? Because I know on my resume, I think I put things like for personal interests, I put like crafts and horseback riding, like things like that. But what specifically do you have any examples?
Yeah, so I mean, if you look at Derek's shirt, he's got Team Smile on. I participated in Team Smile when I was in California at Fresno State, and it was amazing. It was like, you know, geared towards the kids. And so if I said, you know, if I was a hygienist, and I would brag about how much I enjoyed being a part of Team Smile and how I assumed a certain role or how I looked to move up to create something like that, or to maybe organize Team Smile in a town or university that maybe doesn't have Team Smile set up just yet. Stuff like that would be good. The horseback riding is awesome. If you play the keyboard, piano, whatever, that tells me you're into music, you know, things like that. It all just kind of helps give the interviewer a better perspective of who you are, versus just listing straight up stats. You know, like, I worked here from here to here and here to here, and here's my address and here's my references. Great, you want to hire me? So if it's not so straightforward. It's more so given a bigger picture.
I see.
So compared to what you do and then who you are as a personality in the comparisons, I'm guessing.
Yeah, because we want to know you. You're going to be working with us. We don't want to know just how great of a hygienist you are and all the different positions or whatnot you've held. We want to know what makes you you.
You had any follow-ups?
No, that was good. I never thought of it like that.
I think it covered a lot of what we were trying to get into, and it actually led right back into my next question, because we were talking about those key indicators of what a qualified registered dental hygienist may be when you get to that face-to-face. So outside of now, you've identified that personality is good for your office. When it comes to that hygienist coming into your office and you having that face-to-face, what were those key identifiers about what they can do that you generally attach yourself to or want that person to be a part of your office?
You mean what I see in person from them?
Yes, what you see in person, as well as those qualifiers. Do they have a laser certification? Are they proficient in oral communication, or several things in that manner? That's what I'm asking.
Yeah. So the first thing I always look at, I mean, being a dentist, I'm naturally drawn to somebody's mouth when they start talking to me. It's kind of weird, but it just happens. So I automatically will just look straight at their mouth, and I don't judge anybody by teeth. It's just something that I do. And what I do with that is it kind of tells me whether they are being natural or whether they're being fake, I guess you can say, putting on a little front, when they first come in. So you can tell a lot just by looking at their facial expressions. And so that's what I look at. I look for natural composure, confidence. I want them to come in and just be themselves. Of course, there's going to be some nervousness going on, but I try to get rid of that right off the bat at the interview process and throw in a couple of jokes, have some fun, just kind of break the ice and have them just relax a little bit. Once you relax, then I start probing into, like, if you do have a laser certification, I'm going to ask you, why did you get this laser certification? What made you want to get this laser certification? Is it because you're going to get paid more, or is it because you really enjoy the artistic, background behind it and the things that it work and how it works, and you wanted to learn more and you wanted to challenge yourself? Excuse me. So things like that. It's like, if you did something and you claimed a certain certification on your resume, I'm going to ask you why you chose to pursue that. What motivated you to do that? So that's the answers that I get from that is going to kind of help me determine whether this person is going to be a good fit for our clinic or not, because it kind of tells me if there's other opportunities for them to learn something else, I can present it to them and they can go out and learn. Because us being in this industry, we have this desire to want to learn all the time. It's like, I don't know what it is, but it's like you always want to learn something new. And I want to see that in somebody. I don't want somebody who's just going to come in and be content with just doing the basic duties of a hygienist. That's it. I mean, I want to challenge them to become better. Therefore, that way, if they decide to move on after my office, they can leave in a better position than what they were in when they first started.
I like that.
Yeah, I think that's very important. The progression of an individual, and where they want to go and what's their purpose, basically. Definitely. At the end of the day, what's their purpose? That gets into the second part of this question, Doctor. When you've talked to your colleagues and yourself or individuals, other doctors, what are some red flags that you have identified that don't represent a hygienist well, and that you would look for? So that can be into, we've talked about personality, as well as things that they do as a dental hygienist when it comes to their duties.
So from a personality standpoint, when I first, will sit down and talk with a hygienist, I kind of just look for, what got them into the field. If anything comes up where they talk about money, that's an automatic red flag, because the money should never be a part of it. My philosophy is, if you always treat people good, the money will always be there. So it's little things like that you pick up on that kind of tells you a character of a person. But I literally will ask them several questions that will challenge their character, and it kind of gives me an example of who they are. In the clinic, red flags, I see if they start bringing, issues from home to the clinic, that's where we start having a problem, because the patients will start seeing it, mood changes, attitudes and whatnot, because of problems at home. If there's problems going on, within the clinic, and they don't have good communication skills in terms of maybe bringing it up to me or asking, a certain manager or somebody, so communication is huge. And I would say it's one of the biggest things in dentistry, no matter what position you're in, whether you're a dental manager, a dentist, a hygienist, the dental assistant. Communication is like there. So make sure you're always communicating, and you kind of have an understanding of the importance of communication. Other than that, man, I mean, there's several different scenarios that would come up where some red flags would come in, where, let's say, maybe they cut corners when they're wiping down their stations, and they decide, not to wear the proper PPE, especially in the present day. Like, if you're not wearing the proper PPE, you're not only putting yourself at risk, you're putting everybody in that office at risk. So just kind of being a team player and keeping in mind that your actions affect everybody in that office. That's some of the things that I look for. If somebody seems to be a little selfish by doing things that benefit them and only them, those are some red flags that'll come up on my end, where it prompted me to kind of have a discussion with them.
Okay. So very high quality characters you were talking about when it came to personality, communication, teamwork, and different things. So out of those, I know I'm almost repeating myself, but out of those, which one would you think that would be your biggest asset that you look for a dental hygienist?
Communication. Because I feel like communication is the gateway to address all of those other issues. Where, you know, if it's composure, if it's, you know, bringing home work problems and stuff like that, if you can properly communicate with somebody and let them know what your concerns are and what other employees or other team members are seeing, then that person can get a perspective. And if they cannot correct it and you've done everything you can to communicate with them, then that's all you can do. But communication, I feel like, is the gateway to address all those issues. If you properly communicate your concerns and the hygienist properly communicates his or her concerns, that's key.
Mhm.
Yeah, I think that's really good.
Yeah, communication is how we get to our patients, and in that same sense, is how we interact with our coworkers and team. Team
Yep.
is the biggest thing when it comes to us as a dental organization, because we're so small. So it's very important. Now, we've talked about hygienists and we've talked about interviewing. Now, when it's a certain viewer that we currently are talking to right now, we're talking to new grads. Is there any difference from the things you said about a dental hygienist to what you're expecting from a new grad when it comes to clinically and working with the other team members? Is there any difference in what you're trying to look for when it comes to a new grad coming into your clinic or your office?
Yeah, so I always, when I have a new grad, I always look for something we call teachability. They have to be teachable, and they can't be stuck on their own ways on doing things. I mean, when you're in hygiene school or when you're in dental school, you're taught the bread and butter of dentistry, of that field or that position that you're holding. So maybe there's a certain instrument and you hold it a certain type of way to make it work. Well, guess what? When you get out into the dental field, you may not have that instrument, and you may need to do something else and improvise. Therefore, if you're able to actually be teachable and allow the dentist or maybe another hygienist to show you a different technique or to do something and not be like, no, that's not how I learned it in hygiene school. Like, I'm not doing it that way. I want you to be open to learning something new. And so for new grads, you kind of have to find a dentist who understands that you're a new grad and doesn't set these crazy high expectations for you, because you're going to be stressing yourself out to meet that production or to meet that X amount of patients per day. And you may not be comfortable with that. And that's where communication comes in key, where you communicate like, hey, I am a new grad. I do have concerns with my speed. I'd like to focus on this. And if you can please give me some tips or tricks or something to help me out. Like, that's where I'm like, yes, that's what I want. Like, be confident that you're a student. I know you're a student. Don't try to do more than what you are comfortable doing, and allow me to help you grow, and we can grow together type thing. So that's what I'll look for from a student, is I set my expectations really low and I allow them to exceed my expectations, and then I reward them for it. And I let them know like, hey, I thought you were going to be done with this and you did this. Like, that's amazing. That's great. Here's what I would work on. Do you have any feedback, any questions? And then that's it. So it's like, you just kind of move forward and let them kind of have some free reign and do what they feel comfortable doing, but not putting pressure on them to produce.
Just like you said, though, just that communication, because I feel like a majority of the offices that I've worked at, it's I think it's like a misconception being out of school that you can't just say like, hey, I don't feel comfortable with this and I don't feel comfortable with this. Like, you should be able to express your concerns. And also, I think maybe if there's an office that you can't, maybe that's not the right office for you. Because it's like you said, like, you have to be able to work together. So it really just goes back and forth together, you know?
Yep. If you're a new grad, just let them know you're a new grad and be proud to be a new grad. There's nothing bad about being a new grad. That's actually an accomplishment. You just graduated from hygiene school. Like, that's something you all would applaud to. So no need to hide that. And when you go to apply somewhere, you want to have confidence in yourself, but there's no reason to have confidence and say, you know, hey, I'm not a new grad, or hey, I am a new grad, but I can do these numbers or something just to boost yourself. Just be upfront and honest, because if you get the position with the expectations that you're going to do this, like you said in your interview, it's not going to be a good fit, because that dentist or that office and that team is going to be expecting you to do that. And if you're not able to produce, that's going to be a problem there. And not only for the office itself, but for you, because you got all this stress to get to that point. And you don't need to do that. You just be upfront and honest in your interview. And if they don't want to hire you because you're a new grad, on to the next one. What are you going to do? You can't change yourself. You're a new grad.
Yeah, and I've also met a lot of hygienists with years of experience who come up to me and they're like, I forgot what this name is. Like, I forgot the name of this, or I forgot this. So I think it's also like, you know, like you said, just because you're new doesn't mean you're going to know everything, but just because you're older and more experienced doesn't mean you're going to know everything. It's literally just an everyday practice. I feel like I'm still learning things on a weekly basis. I don't know about you, Erica, but.
Oh, absolutely. Every day. And like, just like you said earlier, like I always feel like everybody in this career field is always trying to learn. I am always trying to learn something. Every day I am always trying to learn. And I feel like if you incorporate that into your everyday work, then you're always going to want to be better, and you're always going to want to be the best for your coworkers and for your patients. And that's always a really good philosophy to have for any job that you take.
Mm-hmm.
Yeah, it's a very symbiotic relationship.
Mm-hmm.
The communication with older hygienist to a new grad, to the doctor, to the front office staff, all those different things really have to come together and be a well-oiled machine. Well, thank you, Doctor, for those couple of answers to the questions.
Yeah.
All right. So I'm kind of turning the table and getting into the clinical aspect of when you have your hygienist there working for you. So are you really, how are you with like a dental hygiene diagnosis? They teach us in school to be able to kind of within the parameters and the scope of our practice, make a diagnosis based on what the patient needs for their hygiene. So, you know, I've worked at a couple places where the doctor was just really dependent on me for the dental hygiene diagnosis and was really open for me to ask questions if I needed to. And I've also worked in places where I've had doctors that diagnose the dental hygiene for me, and, you know, based on what they see. So kind of what is your philosophy on that?
So my philosophy basically just goes on a lot of the previous things that I talked about, and it has to do a lot with trust. If your dentist trusts your judgment, and they're willing to allow you to diagnose and to create that next step, I guess you can say, the treatment plan that you're going to be pursuing for this patient to get them back to a normal state, then yeah, that's great. But it all starts with trust. In my current dental clinic, our hygienist, you know, I've developed a certain level of trust with them to where, you know, they come in, they'll, you know, if I'm doing a comprehensive exam, they come in and they'll do my probing, and then they'll give me all their information on what they're seeing of the soft tissue and what their recommendations are. And I'd say 99% of the time, their recommendations is exactly what I go with. But I feel that the more you give hygienists or dental assistants or other staff members expanded roles within their realm of practice, the better it is, because it kind of, if somebody's stuck doing just one thing and you don't take their opinion as a value, it kind of makes them feel like, okay, what am I doing here? Like nobody listens to me type thing, versus you come in, you probe and say, hey, you know, I think this person just needs a prophy. That's it. Everything's looking good. And I say, okay, I'll take your word for it. Like, let's do it. And so it makes you feel a certain type of way that I have that level of trust with you. But that trust takes time to build. So don't expect that when you first come in, especially as a new grad, or even if you are a seasoned hygienist and you start a new job somewhere, don't expect that dentist to just be like, this is how we're going to do it. So don't be offended if, you know, he or she says, hey, I would like to preferably do the diagnosis and whatnot. And maybe later on down the road, after you guys develop that relationship and that trust and that work experience, he or she may continue to, or may change it up and say, hey, I'll see what you want to diagnose and we can go from there.
Great. Kind of in that same vein, I've worked at offices where I'm expected, you know, after I take the x-rays and those kinds of things, you know, kind of do a clinical assessment of what's going on, you know, oral cancer screening, probing depths, you know, taking a look, you know, pit and fissures, that kind of thing, to see if I see any, you know, frank caries, that kind of thing. I'm kind of expected to what they call preheat a patient with what I think the doctor might come in and say. Now, is that something that you're expecting from all of your hygienists when they start to work, or is that something that you prefer to do on your own? Kind of what is your idealization on that?
So what I like to do with our hygienists here is I like to give them the power to do as much as they feel comfortable doing. I feel that I like to educate them a lot on things. So I will sit down and I'll talk to them about pre-medication for like artificial joints and how they can educate patients, to talk to them about x-rays and anesthetics and stuff like that with pregnant women, especially with children, talked about the pros and cons of fluoride. And I try to educate them on all of those things and answer any questions they have on that. And then I challenge them to have those conversations before I come in.
Mhm.
If they have any issues where something is not being communicated, or a patient has been refusing x-rays for, the past 6 years or 7 years that they've been coming in because of a fear of something and they're having trouble explaining it, that's when I come in and I kind of touch on that. But I believe in whole person healthcare, meaning I feel like your health conditions, your overall systemic health conditions like diabetes and high blood pressure, and other, systemic issues like kidney disease kind of reflect as to what's going on inside your mouth. And so I try to teach them that connection so they can have that conversation with patients. So I have them take their blood pressure every single visit, and then they have that discussion with them to follow up if they need to refer. If there's any issues, that's when I pop in. But I want them to be as independent as possible and just kind of know that I'm sitting right over there and I'm a reference. If they need something, hey, I'll be right back. Let me go grab an instrument or something, instead of saying, let me go ask the doctor or whatever it is, I always make my door open. I'm available to talk, and they can always come and interrupt me when I'm inside with a patient as well too. Because I want them to be confident in themselves, and then to have the knowledge to be able to kind of communicate that information to the patient, and to use me as a reference if they need anything. So yeah, I usually have my hygienist do a lot of the discussion, and not because I don't like doing that. As you can tell already, I enjoy talking. I can sit down in an hour procedure and talk for 45 minutes and have 15 minutes to do 3 fillings. It's just, I like to talk to people. You make them feel welcomed, and you're not just like, all right, you're in here, let's drill, fill, and get you out of here. That's not the way I like to practice. Some people do like to do that. But it all depends on your dentist and the amount of freedom that he or she decides to give you in that communication. Some people are really, really picky, and they want to do that. They want to have that conversation. But one thing to note is, whatever conversation you have with the patient, you want to make sure you document it, because if it's not documented, it never happened.
Yes.
So make sure you're always documenting it.
Yes, indeed. All about documentation. We talked about that in our last video, just how important documentation is. And I'm glad that you brought that up so that we can, reiterate the importance of documentation and, write down everything that basically that goes on. So I've had conversations with a lot of students that are upcoming graduates. And then particularly when I graduated, I was really concerned about time management, because you go from where I was seeing a patient for 3.5 to 4 hours in school, and then you get out into like real world hygiene, and then you have all of these expectations about what you're supposed to complete in a certain amount of time. So kind of a 2-part question here. What kind of time frame do you give the new graduates when they're first coming out, when they're seeing, the different kind of patients, prophy, maintenance, SRP, new patient, that kind of thing? What kind of time frame do you give them in the beginning? And then what kind of expectations do you have for them once they kind of get comfortable with their clinical skills?
So I'll refer it to how I work with dental students. I work with 4th year dental students because I'm adjunct faculty at a dental school here in the States. So when I work with the 4th year dental students, what I do initially is I start off by putting 1 filling for them to do. So a little background: dental students will have 1 patient in the morning and 1 patient in the afternoon. That's typically how it is across the nation with dental schools. When they come to our clinic and they start seeing patients, I will start having them seeing 2 patients in the morning and then 2 patients in the afternoon. Then gradually, they're there for 1 month. And so gradually what I do is I start adding, an extra procedure, an extra thing. And then once I feel like that person is confident in what they're doing, they're comfortable, and their work reflects that, and they're not just rushing to try to do sloppy work and be done, then I add on more and more and more. But if they need work, I kind of take a step back and I slow down and I tell them to hone in on their skills, their confidence, and then to use me as a resource if they have questions about anything. But I don't put pressure on them to meet a certain expectation. I kind of let them work, and then I see what their level of skill is and their confidence, and then I try to help them build upon that to become better. With dental students, within that month, they go from seeing 2 patients a day to potentially seeing 6 patients a day. So I mean, it goes up drastically. And then for hygienists, it's kind of a very similar process. I mean, it's the same concept. You got to find a doctor who's going to be understanding the fact that you are a new grad or a recent grad, and you're still working on your skills, and you're still eager to learn new traits and new skills. So if you just work with a doctor and communicate that you're not comfortable doing X amount and you'd like to do this, and here's what you're doing, but you're working on improving. If you notice anything, let me know, type thing. That's always the best approach versus just going in and trying to meet those expectations, because then your work starts getting sloppy. You start missing, calculus or certain surfaces on teeth, and the dentist comes in and he or she does their check and they're like, hey, did you not see this right here? It's like, it's right in front of your face. How did you not see it? So the dentist's confidence in you kind of goes down if you never communicate with them that you don't feel like you can achieve those numbers.
I like that, yes, because I definitely know, like when I started my first job, I told them right off top, I was like, listen, please don't throw me to the wolves, because I will not succeed in that type of an environment. So please just give me time to shadow, and if you can give me extended appointment times, that'd be great. And they were really, really great about it. That's just one of the best things I can say about that office. They gave me a bunch of time until I got comfortable, until I felt like I could run like a regularly scheduled hygiene book for the day. And by the time I got there, it gave me time to figure out all of my everything that I wanted to do in the order I wanted to do it, and how I can maximize my time, how I can multitask, because I'm not sure that they really tell you, because you have so much time in hygiene school, you don't necessarily have to do as much multitasking as you do when you're in real world hygiene. It's a lot of multitasking. You're doing a lot of things all at once. So once I got really comfortable with that, it made it a lot easier. So my advice is for new grads is tell your office, listen, this is not what I feel comfortable with. If you can give me more time, please do that, because I will not succeed if you just kind of throw me in there.
But I think too, just asking for that time, like, can I shadow? Because in my experience, I felt like right away, like they're like, okay, let's get you in for a working interview. And it's because they didn't want to pay for a temp for that day. Whereas it's okay to ask, like, hey, can I shadow for the first part of the morning? And because you can always set up a working interview later, but that's something that you don't know, just coming out of school, you do feel that pressure to like, all right, got to get in there, got to go, so that's awesome, Erica. That's a good point, is asking for that.
Yeah, and make sure that the support is there from not just the dentist, but also the assistants as well, because in our clinic, if the hygienist is running behind, the assistants will come in and clean their room while they go grab the next patient, and they got another room ready for them to go so they can kind of catch up, especially if your assistants are sitting there, doing nothing, and it's a slow day for the doctor, or there's cancellation or whatnot. You got to make sure that support system is there too, because if you do run behind, it happens. It's called life, unexpected things tend to come up, or in my case, you tend to talk a little too much. So you got to have that support where they can help get you back on track. And if you don't have that, and it's all on you type thing, that's something you want to communicate with. Back to letting, your doctor know that you are a new grad. I feel that, one, they should already know that you're a new grad because they've reviewed your resume, and they wouldn't be calling you for an interview if they didn't know that. Or two, maybe they didn't even read your resume and they're desperate and need a hygienist and they just called you. So you got to be aware of that, and don't ever assume that they know that you're a new grad. Make sure you communicate that.
Definitely a good follow-up. We mentioned that last video we had as well, about the understanding of if they read your resume or not.
Yep, because Dr. Joy said to make sure you bring a copy, because you never know that they actually looked at what it was that you sent to them in the first place.
Yeah, some people, I'm not going to speak badly about it as much as I can, but it's the honest truth. Some doctors who are looking for hygienists, if they're desperate or whatnot, if somebody applies and you're the only person that applies, guess what? you're getting an interview, and it may not be because you're qualified and super awesome and great or whatnot. It's because they're desperate. So in that interview process, you need to communicate with them who you are and the assumption that they actually did not read your resume. So
Mhm.
you gotta just let them know, and also have confidence in yourself in knowing that, what price range or what salary would you like to get coming out as a new grad? Because most dental offices will look at a new grad and say, hey, I don't expect you to produce this much, therefore I would like to pay you X amount of dollars for a salary here. You got to kind of know that you're not shortchanging yourself in that just because you have that new grad title. So have some confidence in yourself. If you feel like you are worth more, communicate that and show them that you're willing to learn and to deserve that salary that you're proposing, and go from there.
That's really great information, because definitely, I know that when I first came out, I felt a little shortchanged compared to um, some of the other rates that some other hygienists were getting that graduated with me. But I felt like I had to take it because I was a new grad, and I needed the job. Like, I needed the job. I was so broke. So broke. I needed to work. But
But how did that make you
considering,
feel while you were working at that office, having that
oh, I
salary and
was
knowing that you were?
resentful. I was
See?
resentful.
So that's what I'm
Yeah,
saying. You will hate your job and hate
yeah,
being there if you do feel like you were unappreciated or not
yep.
compensated well. Therefore, it's your job to communicate that and no. Now that was a learning experience for you. Now, if you go on to another job, like, hey, this is what I'm looking for. Here's what I can
Hmm.
bring to the table. This is me. Here's what I can do for your office.
Mhm.
Absolutely.
And I feel like
Absolutely.
it just comes with experience, like
Hmm.
growing that confidence. But a lot of people don't know any better. And that was one of the
Yep.
main goals of us starting this little mini series, is to let people know, like, hey, you don't have to do that.
Yeah, you
I
guys
was,
have gone through those initial steps and learned from those mistakes and know how those mistakes have made you feel. And these guys that are watching this video are super lucky that you guys are sharing your guys' mistakes with them so you can help them avoid it and be
Hmm.
more happier in their profession and get better
Absolutely.
jobs and grow and become better based on the mistakes that you guys have made and the advice that you're giving. So that's awesome.
yeah,
I,
thank you.
I think that's great. I think, inadvertently you've answered all my questions here. So I'm gonna
Told you I talked a
I'm gonna
lot.
scoot it on over to Miss Brooke here, and she's just gonna talk kind of about office personnel and what that looks like.
Yeah, so one of our questions is, what are your expected functions of the hygienists? Your expectations of what their expanded functions are. Like, do you expect them to go file or make calls, or do you want them to just stay in the back and strictly clinic, or how does that work for you?
So they do stay in the back, but I have them do what's comfortable for them. Like if they have a desire to learn, I have them expanding and doing multiple different things. If they want to, come in and see, what I'm doing within an extraction and decide, hey, their patient canceled and they want to come assist or something, I'll have them learn new things that I'm doing there. Or if there is a discrepancy in, let's say, a blood pressure for a patient, I actually will have the hygienist call the patient's PCP, primary care provider, and have that conversation with them and say, hey, such and such presented with this blood pressure. Can you tell me what it was when they came in to see you on this day or whatnot? I have them make that communication so they can kind of work with providers. And again, it goes back to just giving them responsibilities to make them feel valued and to show that they are
Mhm.
valued and that they are taking so much pressure off of me with all the other things that I have to do in the office and to value the work that they are doing. And I don't know, when I get given certain tasks to do by higher ups, like in the organization, it makes me feel a lot better because it makes me feel like they trust me in what I'm doing and allowing me to go do these new things. So I allow them to do a lot of things. They can file um, prior authorizations for insurances. So I have them, fill everything out and then they send it to me so that I can sign it. And then we send it off to the insurance company for whatever type of cleaning we decide to do. So I give them that part and answer their questions. That way they can learn. Like I said, I want to make them better than when they first started. So if they learned about the whole insurance process and how that works, because they actually got to fill a form out and see the whole process and how it works versus going to an office that doesn't allow them to do that. Now you have that new experience. So when you go apply for somewhere else, you can say, hey, I used to fill out these forms for insurances. I worked with this. I've called insurance companies. I talked to primary care providers. I've assisted in surgeries. I've done this. I've done that. So it's like everything that you can brag about that you couldn't brag about before.
Yeah, I think that's wonderful, because I think the hardest part of when I first started working was understanding insurance. I still don't understand insurance. I have a better understanding of insurance because I made it a point to get together with the business assistants that were working at the front so that I could help them like I could help them while they were helping me. But, you know, with insurances, every policy being different, and then you have all the different companies, that's so confusing. So I think that that's great that you give your hygienist the opportunity to learn that because, man, I think that's the hardest part of the job.
Definitely. Yeah,
Definitely another asset.
yeah, definitely. And one thing to know for all the new grads is you shouldn't let a patient's insurance determine their treatment.
Absolutely.
Definitely not. So, I mean, you work with your front office to see if they got, you know, a sliding fee program or something that you can apply for, or state insurance or something. But a patient's insurance should never dictate or guide what type of treatment or that they're able to receive. So you give them all of their options and you allow the patient to make the decision and not just not telling them what a treatment option is because you know it's not covered from their insurance. Give them that option.
Mm-hmm.
Which kind of brings me to another question. So we talked about this in our last video, but how do you handle a patient who is complaining because the hygienist recommends deep cleaning and they only want just a regular prophy? Like, how do you handle that? Like, how do you step in? And
so the way that I do it is, I mean, it all varies per patient or per case. If the probing depths are extreme, like if you're talking about you got some 9s and 10s and whatnot, that's where you sit down and maybe it might be a barrier in communication. Maybe the patient didn't understand what the hygienist was trying to say, because sometimes hygienists get so fixated on explaining things that they forget that they're talking to a normal person, not somebody who's in the dental field. So they start throwing out these lingos and words and terminology and this and that, like, oh, you got a 10 millimeter pocket depth and this and that, versus saying, look, on this tooth, I took this probe and I put it in between your tooth and your gums and I dropped it down this much. So that means that your bone level. So bringing it down to layman's terms and explaining it to them sometimes will instantly change their perspective of it and be like, okay, yes, I see the importance of it. I don't want to lose my teeth due to periodontal disease. I want to make sure I keep them forever. I like eating peanuts or something, you know? So it's like, it has to do with communication. So the first thing that I do is I come in and I do that, because that's what I'm going to automatically assume is that there was something that maybe, and sometimes it's not even the hygienist's fault. Sometimes, which is crazy, but you will experience this a lot, they don't want to hear it from you. They want to hear it from the doctor.
mm-hmm.
And I don't know what it is, but it's like you can sit there and tell them everything that I just told them, and they will say yes to me and no to you.
Yep.
And so just understanding that and not letting it get to you is a huge plus, because you're going to leave that office, operatory room, and go to the dentist and be like, I literally just told them exactly what you said. And they said, nope, nope, nope. And you come in and yes. And so it happens all the time. It's just what it is. I mean, it is what it is. If you understand that, then you'll be good. So having that communication there and knowing that is also a thing. And sometimes patients just don't want it. And if they don't want it, you do what you can. Basically, the treatment that you provide to a patient should leave them in a better position when they leave your office than when they first came in. If you feel like a regular prophy is going to be better than doing absolutely nothing, then do a prophy. If you recommend an SRP for the patient, you let them know the risks of it, of not doing the SRP with their present condition and what it can cause and all that, and you make sure to document all that, and you give them just a prophy and let them know, like, hey, next time if these pocket depths don't improve or if it seems to be getting worse, we're going to need to do this. And if that patient continues to refuse, your doctor may consider saying, hey, you know what? you're not really a good fit for our office. Let me recommend another office for you to potentially go to and see if there's another dental provider or dental office that may like to see you. And your dentist should be comfortable doing that. If there's somebody that you're uncomfortable seeing, because either they're verbally, abusive, or they never listen to what you have to say, or a lot of the times, believe it or not, there's a lot of inappropriate touching, hand on the leg, or certain gestures or comments. I mean, there's a certain extent where you can somewhat accept it. It's based on your personal level. But if you're ever uncomfortable with a certain patient where they don't want to do treatment, that you or your doctor are recommending, and you're having to constantly call them in, just communicate with your doctor and let them know. And he or she may elect to say, hey, let me find you another dental office to go to because you're not a good fit. And that's perfectly okay. You're supposed to see as many patients as you can, but comfortably. You are not their slave, and you don't have to do exactly what they tell you to do all the time. Although you do have to listen to what they have to say, don't ever feel obligated and pressured to stop doing what you recommend doing and doing exactly what they say. Because that's not the way it works. You're the professional, you're explaining their options to them. And if you can't develop that relationship or that trust, it's not going to be a healthy relationship, and you're just asking for problems down the road.
I kind of have a question I'm going to throw in there. Sorry, Brooke, to, get up in the middle here. With that being said, not feeling like you have to do everything that they tell you. I definitely have felt, and I think that Brooke can attest to this, is feeling like you can't say no, that you feel like you kind of have to go through and do exactly what they're telling you. But also, we get a lot of these commands and, orders. Sorry, I was in the military, so think in a different lingo than some people. Like, we get these orders that are coming from like an office manager or somebody that doesn't have a license, and that is seemingly acting on the behalf of the dentist, but they're giving you instructions that is gonna like run you ragged, basically. Like, there was one day where I was double booked all day with new patients all day, and I'm like, literally, I didn't eat lunch. Like, I'm dying, but everything that I'm being asked to do is not coming from a dentist, it's coming from an office manager. But she's not understanding that with all of these things that are being put on my plate, I'm not having the time to administer, complete care. It's all seems mediocre. So kind of how do we kind of approach that particular situation? Because I feel like I've had a lot of issue with that in the past.
Yeah, so you're going to notice that across the nation, everywhere you work, you're going to notice that, there might be some issues with that. And again, communication is super key. So if you just kind of take a step back and look, what is the office manager's job or role? It's for him or her to manage the office. And with that, if they manage it well, they get a bonus or an incentive, or they get, paid a certain salary. Therefore, if that person that's there, the office manager that's there, treats their staff a certain type of way, that kind of reflects as to their management skills. And if that isn't communicated to the dentist or to the person who is in charge of that office manager's job, then there's no way that anybody's going to know how they're running their ship. If they're standing there just cracking a whip and making you work, and not taking into consideration how you're feeling or how your body is feeling, or how you feel like, hey, I don't feel comfortable doing this, but I feel like I'm forced to do it. You should never feel forced to do anything. But always keep in mind that there's a fine line that a lot of managers have to kind of not cross. It's a very, very fine line. And what I mean by that is, put yourself in their shoes in a management position, right? Let's say you have a patient who is just, extremely, extremely complex. Let's say they have a disability, and they're wheelchair bound, and they're stuck in and have to be in that wheelchair and confined there, and you have to provide treatment in a wheelchair. You have a hygienist that works in your office that says, oh, I don't work on people in wheelchair. Like, they have to be in my dental chair because I'm not going to break my back or something, There's hygienists that will say, I don't do that. And if the office manager says, okay, sure, no problem, I'm going to give this patient to Erica and have Erica do it. If they do that and they have favoritism, whatnot, and treat one assistant or one hygienist better than the other, that just kind of shows you how they are allowing that line to be crossed. Because at the end of the day, you're in this field because what? You're treating patients. It's your obligation to provide care to patients. Therefore, you should be picky, but you shouldn't be super picky on who you provide treatment to. If you have a legitimate argument as to why you don't want to provide treatment to this patient, then perfect, bring it up to your manager. And if your manager makes you do it, ask them why. Just tell them like, hey, I didn't feel comfortable doing this, why? And then they should be able to give you an explanation as to why they feel like you should be able to do this, and not just dismiss your argument. That hygienist who said that she doesn't treat patients in wheelchairs, that's not a valid argument. So therefore, that manager should never allow that patient to be transferred to another hygienist. They should have been forced to do that. So those things happen in offices and nobody notices it unless you're the one that's being affected by it. And so if the dentist doesn't know about it, then they don't know how their manager is running their ship. So you just got to communicate with them and let them know, hey, if I'm not comfortable doing it, think to yourself, is this a valid reason for why it is that I do not want to treat this patient? Because at the end of the day, that's your job, is to treat patients. But it's supposed to be comfortable and it's supposed to be a good relationship. However, if they have expectations that are really high and you're trying to bring them back to a normal level where this is what you can offer, because I get this a lot where patients come in and they say, I want to save all these teeth. And I'm like, you can't save all these teeth. They're gone. Like there's only roots that are left. And so if they don't have that expectation there, I'm not going to say, hey, I'm going to have you go see this other dentist. I'm just going to have this conversation with them. And if they don't see it eye to eye with me, I'm going to say, you know what, I can refer you to another office, because you've done what you can and given them your options of what you can do. And if they don't accept it, then they don't accept it.
I think that goes into what. Sorry.
Oh. It just kind of brings me to another question, because let's say you end up quitting because of conflict with management. So now going into your next interview, how do you present that? Because, most offices are going to ask, well, why are you looking for a new office? So me personally, I don't like to dish the negative stuff. And I just don't feel, even if I may have had issues, I'm not going to carry that on. So what's a good way to present that without seeming negative about it?
What you do is you want to talk about what you are looking for in a new clinic that you're going to be working at. So what I say is, if they say, why did you leave your previous job and why are you looking for a new one? I would just, come back and say, I'm looking for a position that's going to encourage me and push me to become a better person, that has open communication and allows me to grow as an individual. And then also you can talk about how you like to be treated as a person, and have your opinions be heard and listened to and stuff like that. So it's not necessarily directing and saying that all those things are going to be negative towards that other clinic, but you're just telling that person who's interviewing you what you want that you didn't get from the other office. So it's kind of like you're just explaining what it is that you're wanting, and that kind of implies why you left the other office, because you weren't getting it. But you're not specifically saying they didn't treat me good, they didn't take my opinions, this and that, the doctor was coming in late and putting pressure on me and this and that. Like, you don't want to badmouth that type of way, because it doesn't look good. And even though you may feel that way, you just got to have that composure and just tell them what you're looking for, and basically emphasize on the things that you didn't get from the other office that caused you to leave, but change it in a way of saying, this is what I'm looking for in your office.
I like that.
Okay.
Did you have a question, Gary?
No, I was going to make a statement earlier about what the doctor was saying. More of everything he's saying when it comes to patient acceptance of these different things. It's more about patient perception, and going into what the doctor was saying about communication with the patient, what's going on with them, the education, as well as providing that same communication to the doctor and what you stated and where they were. And if it's necessary, going into the situation of referring a patient out, maybe for a treatment from another dentist, or maybe referring that patient out for a periodontist because their pockets are too deep, or they have those different issues that they're not really recognizing by them being in our office. It may be a different avenue to take.
Yeah, at the end of the day, like I said, we're in the field to treat patients, and as a dental office, whether it's a community health center or whether it's a private office or a corporate office, your job is to treat patients. And then as much as we don't like to think of it as a business aspect, there is a huge business aspect of it in any dental office that you work for. They need to keep the lights on. They need to be able to pay your salary and get you the equipment that you need. It is a business. Therefore, you don't want to have to refer patients out. However, if you've exhausted all of your options and the expectations or the relationship is just not there with the patient, you're asking for more trouble down the road. And is it really worth keeping one patient and having, unhappy employees and having potential issues with a patient suing you later on or writing a negative review online and hurting your business? It's not really worth it. And that's where the manager or the dentist will decide, hey, I think it's best that we transfer your care or ask for another provider to see you. And then their job is to have that communication with the next office that, hey, here's the issues that we had with this patient. Would you be willing to see them? And we'll give you their referral info type thing. So yeah, you should never feel obligated to see somebody, but also understand that where you're working at, it is a business and there are stresses and there are expectations, especially for like a federally qualified health center, FQHCs. You got to see X amount of patients from a certain type of, state insurance or whatnot. So you got to have that mindset as well. You can't just be like, oh, let's just dismiss this patient. Oh, we're going to dismiss you, and you. We can't do that. So you got to just kind of step out of your comfort zone sometimes and do what you have to do to give the patient treatment, but also know that it's a work in progress. Maybe they're nervous. Maybe it's their first time getting this type of cleaning and haven't been to a dentist in forever, and they've gotten regular cleanings and now all of a sudden they need something called the deep cleaning. Well, what does that mean? I don't want to do that. I've always gotten this. So maybe it's a work in progress. If you feel like after 2 visits or 3 visits, you've tried to communicate with the patient and you got the proper documentation that shows that, you can say, hey, I've really exhausted all of our options. I try to create a relationship with this patient and make it positive and provide them care. However, they're not having it. Therefore, I don't feel like they should be a good fit. And that would be a conversation you have with your manager or with your dentist. And you have the proof to show that, hey, I've tried, you've tried, we've all tried. I don't know how this is going to work.
What about health or financial benefits? What do you feel is ideal and what do you get asked for the most?
So sometimes there's a balance, maybe your salary isn't so great, but hey, the benefits is what actually throws it off the edge because they got a good 401k plan with a match. Maybe they allow you to have, an HSA account and they provide dental and medical insurance, or your services at the office will be treated as, free. Like you don't have to pay for a crown, or maybe it's like 80%. So there's offices that'll make different packages for their hygienists and whatnot, especially in private offices. They have more leverage because they can create the rules. They create their own packages. They're in charge of everything. Versus if you work at a corporate office or a FQHC, there's certain things that are within the organization that are just generally offered. So I would always say to look at those options and to not just have one option. So interview at multiple different offices and see whether you want to work at a big organization that's, a federally qualified health center, like a community health center, or if you want to work at a private office, or if you want to work at a corporate office. Lay all the options out on the table and just kind of look at them, and don't only look at the salary. Look at some of the other benefits that are offered in terms of like, do you get certain discounts to certain places that you shop at? Is there a 401k with the match? What is that? Is there dental medical insurance that's covered? How much is that going to cost you? Can you get an HSA account set up?
Paid holidays, like that's like
huge,
unheard of.
Is a big thing, and vacation time, and then also another thing you want to ask for is the vacation time accrued days, or is it just given? So some people, some offices will say, hey, you got to work here for a month and then you get 1 day, another month 2 days, every month you get a day, or do you get the full 2 weeks or a week off for vacation right off the bat after you complete like 60 days of working at the office or something? So those are some of the things that you want to ask for. Maybe if there's any sign-on bonuses, or if there's any type of relocation expense that's covered, things like that. People can get really creative with the packages. If they really want you or they really need you, they will make it. Especially these rural areas. If you're in a rural area and you want to work somewhere rural, they're in desperate need because there isn't a Target, there isn't a Walmart, there isn't this. You got to drive X amount of miles to get to some of these places, and they understand that. Therefore, they make their packages very lucrative. And very beneficial, that's going to be good for you long term to save money, and it might be good for your family as well because they provide extended coverage to family members. So just some things to think about. Just lay your options on a table and talk it over with, your conscience and your significant others.
That's good. Thank you. I think that's kind of all my questions on my end, guys.
Definitely.
Oh, I have one more question. Are you hiring by any chance? I know, kind of come in a package of deals, so you could get 3 really great hygienists here.
Yeah, well, I mean, we gotta see when we open back up, if everybody is still gonna be there or not. Because it's like, when offices are closed, I reading online, I see a lot of, I think this really applies towards dental assistants. Dentists are having trouble having their assistants come back to work to open up because, believe it or not, they're saying that they're getting more money from unemployment than they are when they work there.
Yes.
They're like, why am I going to come back to work when I can sit here and get unemployment? Like, that doesn't make any sense. I don't know if that necessarily applies to hygienists. I think you guys make a lot more than that. But it all depends. I mean, these situations with COVID-19 and situations like this kind of have you reflect back on your present situation, because you're able to actually sit down and gather your thoughts and think, because that's all you have to do when you're sitting at home doing nothing. So you sit down and you think, and you're looking at your surroundings, and you're like, is this where I want to live? You start questioning, like, do I want to work here?
Yeah.
Are they treating me right? Do I want to start looking for something else? Do I want to change? Do I want to do this? And that's okay to ask yourself that. So that's what I'm saying is when we finally open up, at the end of the day, we got to see who's still there and go from there, essentially. So there's going to be a lot of turnover, a lot of changes across the nation in several different offices. So for new grads, this might be a plus for you because there's going to be several places hiring.
Yep. Totally agree.
Absolutely.
I do too. I do as well. I think the viewers would agree. I think you said a lot during this period of time, Doctor. And I was going to ask for your final words, but you said a lot in that last one. Did you have anything else that you wanted to pass to the viewers, to give any other additional information that may be beneficial for them when it comes to interviewing clinical office personnel, personal protection when it comes to the COVID? Did you have any last words outside of those?
I would just say, it's super cliche to say, and everybody says it, but I'm gonna say it as well. Just be yourself. You chose to dedicate time and effort into going to hygiene school and to become a hygienist. Be yourself. Understand what it is that you got into, and if for any reason it is, you decide that hygiene is not for you, it's perfectly okay. It's going to be tough because you got to change your whole perspective on, where your career is, and you may have to go back to school. But if hygiene is not it, don't force yourself to do it. It should be organic. You should enjoy that communication, that level that you have with, and that relationship you have with your patients that you treat. And majority of the time, believe it or not, patients will come to an office not because they enjoy seeing the dentist, but because they love their hygienist. And that's all they brag about is their hygienist. Their hygienist. Oh, my hygienist this, my hygienist that. You guys will see a patient far more than what we will see a patient. And we actually want that, because that means that we're doing something right to prevent cavities from forming. And it starts off with you guys having that conversation with them and making sure that they're taking care of their oral hygiene and understanding, the sugars and how bacteria and everything works in the mouth. So if you don't enjoy that aspect of it, or don't enjoy being a hygienist, it's perfectly okay, so long as you give it a shot. You may be working at a dental office that you don't like, and you say, oh, I hate being a hygienist. This sucks. Try out a different office and see whether that changes your mind or not. Don't be so quick to give up on all of that investment of time and money and dedication that you've put in the past to get to where you are today, just because of one bad experience at a dental office. Go find another job. You may need to bounce around to 3, 4, 5 jobs until you find that one job that you actually enjoy and like. Network, communicate, talk with people, talk with other hygienists, be a part of different organizations, join memberships, subscriptions, where you can have a dialogue with other people that are in your field, so that you can see what they're doing and what they're saying and what they're feeling, because you'd be surprised as, how many times you can have other people relate to the same story that you just gone through. You'll be scrolling on Instagram or whatnot, and you see a little meme about a patient showing up late and the hygienist running to go do something. It's like, oh yeah, that happened to me today. You're not the only one, you know. Everybody across the globe is having similar issues that you're having. So it's not just you. So just be yourself, make sure you enjoy the profession and have fun with it, as I do with music and education and whatnot. It's if you're just doing just dentistry, scaling and taking probe readings and whatnot, you're not going to have fun. But if you joke around, if you have fun, if you make it something where not only is it just yourself that's involved in dentistry, but maybe your family members, you know, things like that, you know, doing extracurricular activities comes in handy. And then if you want to challenge yourself, there are like what's called brand ambassadors, and they're always looking for hygienists. So like those, like that Burst Oral Care, that's one company, the toothbrush. They're always looking for ambassadors. I know Snow Teeth Whitening is always looking for ambassadors, and the way that works is you literally just get sent their product and you try it out and you give your honest opinion from a hygienist perspective as to how this product works. And if you recommend it, and you get a certain percentage of whatever it is that they decide to buy based on a referral code that you use. So there's different companies. So if you want to go into that aspect of it, you got that avenue. There's the education aspect of it. If you want to do things such as you guys are doing now, this is also fun here. And this right here is something you can put on your resume. Like, hey, I held these, I did these videos where I connected this and I provided this information. It just kind of shows another side of you. Although it is part of dentistry, it's different. This is not something you're getting paid for to do. This is all volunteer time and just to kind of give back. And so just be yourself, have fun with it. And if you ever have any questions, and there's no dumb question, literally there is no dumb question, just ask. There's resources that you can ask, and you know, I can make myself available if you want to ask any other questions that we didn't answer today. And then if you choose to pursue, I had several classmates that were hygienists before that decided they wanted to go to dental school. So if you decide you want to do more, you enjoy surgeries, you enjoy, you know, doing fillings and making dentures and veneers and all that stuff like that, let me know. I mean, I'd be happy to answer any questions you have about applying to dental school and what some of the requirements are that we're looking for. But yeah, I just make myself available and reach out. Don't sit there with your thoughts and don't ask. Just ask. Even if you feel like you look dumb asking, just ask.
Mm-hmm. Totally.
Definitely agree, Doctor. And talking about networking, can you give us your handles again for Facebook, Instagram, one more time before we get up?
Yeah. So on Instagram, it's at Dr_GIBBZ. So it's Dr. Gibbs, but there's an underscore in between the doctor and the Gibbs part. On Facebook, it is Gibbs, GIBBZ, and then it's DMD. If you go to like Google and you just type in Dr. Gibbs, I think all the handles and everything should pop up on there. And then, yeah, you can check out some of the videos that I did. And if you're into music and you want to collab and do something, you guys can reach out and let me know. Or if there's a certain topic that you want me to discuss, I can write a song, record stuff for that as well, and put it out there. But yeah, I'm just having fun with it, and you should do the same.
That's awesome. Let me just tell you, by the way, I have a rap name.
Oh,
Money. I can't rap, but you know, I got a name going, so that's a good start, right?
What is it?
What is your rap name again?
Broke Money.
Okay.
Broke Money with the gold molar earrings.
Right.
Exactly. High five.
Yeah.
I got them on Etsy. I think it was 5 pairs for like $6.99, so I like a good deal.
Yeah,
hey, broke money is better than broke molars.
Hey, I don't know. I kind of like that too. That might be my dad's name. Thank you so much, though. We really appreciate you taking the time to talk with us.
Yes. Thanks for having me.
Thank you so much, Doctor. Thank you, viewers, for tuning in to us. But remember, like the video, tell a friend to take a look so we can get this information out with Dr. Gibbs and the rest of our videos. More viewers, more information being passed on. Follow us, subscribe to Brown Girl RDH, Instagram, Facebook, check out Dr. Gibbs with his handles as well. And just make sure you try to become a member with Brown Girl RDH for the students and for the professionals license. And lastly, I just wanted to go over to make sure that y'all follow up with us after this video. We have our next video coming out, which is going to be the clinical part 2. So we spoke with Chris Love, Black Panther, previous to Dr. Gibbs. Then we have Dr. Gibbs, and now we're going to go back into our clinical part 2. So make sure you follow us and you check out those videos as well. Thank you all for taking a look at us and being committed. We're trying to pass as much information as we can to you all, so you all can be successful in this career. Thank you again, Dr. Gibbs, for joining us.
Thanks for having me.
All right, we'll see you guys soon.
All right, have a good one.
Bye.